One test that we use here at Optimize Chiropractic is the limits of stability test. The limits of stability looks at how well you're able to lean forward and back and to your left and to your right. Let's break it down. As you stand, you have a center of gravity. Essentially, if you dropped a plumb line in the center of your body, it would show where you put the majority of your weight, your center of gravity, your center of pressure. The limits of stability looks at how well you're able to move your center of gravity to the front and the back and to the left and to the right. So why is that important? Well, let's talk about an example when it comes to balance, and then we'll talk about how it relates to lower back pain and why this is one of our objective measures that we use throughout care. Imagine, or maybe you don't have to, that you're an older individual who doesn't have the best balance. You're most stable when you keep your center of gravity inside your limits of stability, inside that little square. This is where your body is comfortable. However, let's say you're walking down the street and a curb jumps out at you, or rather you're crossing the street, you lift up your leg to step over a curb, but you don't lift your leg up quite enough. You catch your toe, and all of a sudden, that center of gravity that you were comfortable within that limits of stability moves out here. It changes to an extreme. An extreme limit of your stability is challenged. This can result in a fall, a stumble, or you catch your balance and you go on your way. That's how our center of gravity plays a role in the limits of our stability. We're comfortable and we feel stable within that limits of stability. Again, limits of stability. However, when it comes to individuals with lower back pain, their limits of stability decreases with the pain. This is usually due to a combination of factors. First, individuals with active low back pain typically restrict movement of the trunk, which then can result in having to use more effort to maintain stability and balance. Think of it this way. When you walk without pain or discomfort, the body typically has a sway to it. However, when having low back pain, we try and restrict that movement in order to protect or guard against any pain or further injury. But when we restrict the movement of the trunk, it then results in us having a smaller limits of stability. The box gets smaller and we're unstable out here. Short term, from a balance standpoint, this is okay. However, if we make these changes to our gait and posture in order to guard against extra pain and movement, and the pain persists, and we continue this protected posture, we can start to make that reduced limits of stability more permanent, leading to worse balance as well as more pain. If someone is coming to see us here at Optimize Chiropractic, we use the limits of stability as a way to measure a baseline level of movement. We look at a lot more than just limits of stability, but the limits of stability gives us a baseline of how well the individual is able to move at the beginning of their care, and also let us know if there is an asymmetric or uneven pattern with their movement. During this process, we are also able to watch how they coordinate their movement and how body aware they are. Two things that will affect the individual's specific treatment plan. Pain is common, but it's not normal. If you're an individual who suffers with back pain, give us a call at 614-769-7831 to schedule your complimentary consultation, or visit us online at datadrivenchiropractic.com. I hope you enjoy your day and continue to follow along as we share more about our data-driven approach.